Okay, so today I will be performing an abdominal assessment on you today. So I'm going to be looking at your abdomen as well as your kidneys. So it is good that your knees are bent and that your head is in a 35-degree angle. So I would look at your abdomen from all different sides, from a lateral position, from standing over it, to make sure everything looked okay. I would have you empty your bladder beforehand before I started looking. That way you couldn't see that it was distended or not. I would inspect with tangential light. Um, when I looked at your abdomen, I'd be noting any pulsations or anything that I may see. Normally, you wouldn't see any movement in the abdomen anyways. You would want to make sure that there was no peristalsis. You would inspect the abdomen for any scars. If there are scars and it's painful underneath, that could mean there are adhesions, so you would want to let the doctor know about that. You would want to look at the umbilicus to see if there was an umbilical hernia as well. Okay, so now I'm going to be listening to your abdomen. You always want to inspect before you listen. So I'm going to be listening to all four quadrants with the diaphragm and my stethoscope. I'm going to be noting if they're hypo or hyperactive. And instantly I can hear vowel sounds. Okay, so I note that they're normal active. And then I would listen for any bruits. I would listen for vascular sounds, so I would listen over the aortic area. And I don't hear any bruits. Okay, Faith, so now I'm going to be palpating your abdomen. Please tell me if you feel any tenderness or pain at all when I'm touching. So I'm not going to go real deep, so I'm just going to lightly start palpating and touching. I'm going to keep an eye out for any obvious guarding and any facial grimaces or facial expressions on Faith, and I don't see any, so there's no obvious guarding or any facial expression. Okay, so since there was no tenderness with the light palpation, I am going to go a little deeper, so I'm going to put one hand over the other. I'm just going to feel in all the different quadrants for any masses or anything that doesn't feel right, but the stomach feels soft, it's non-distended, and I don't feel any masses in any of the quadrants. Okay, so I'm going to be finding Faith's rib cage and use a hooking technique to find her liver. So I'm going to put my hands right here, and I'm going to have you take a deep breath, and I'm going to gently just feel right in here. Okay, you can breathe out now. I'm going to put my fingers here and see if I can feel the liver move underneath my hands. I don't feel anything, so I would say that the liver is non-palpable. And I would feel for any nodules or masses. And then I could feel right over here. And I would have you breathe in and breathe out to see if I could feel the spleen. And I don't feel the spleen at all, and it's not palpable, and both of those are normal findings. Okay, so now I'm going to be moving on to abdominal percussion, and again I'm just going to try and get a general feel of what the abdomen sounds like. So I'm going to start percussing. Okay, so the abdomen sounds pretty tympanic. Sometimes in the lower quadrant it can sound kind of dull in case there was stool in there, but the abdomen sounds tympanic without any dullness. Okay, so now I'm going to percuss out Faith's liver span. So I'm going to start up here, which is pretty far up. Okay, and first I should hear resonance from the lungs, and as soon as I hear dullness, then that's the top of the liver. Okay, so I start to feel dullness right about here, so I'm just going to mark this with a piece of tape. Now, in a woman, you may have to go up under the breast to be able to hear it well. Okay. Alright, so now I'm going to mark right here, and that's the beginning of the liver. So now I'm going to come down to about the umbilicus level, and I'm going to start. Okay, so I hear a little tympani. And then once I hear dullness, which is right about here, I'm going to mark that. And that's the end of the liver. Okay. That's it. Okay, so now what I'm going to do is I'm going to take my ruler and I'm going to measure at the midclavicular line where the beginning of the dullness is, so it's the beginning of the liver, to the end of the dullness, which is the end of the liver. Okay, and I'm getting about 8 centimeters. So Faith, that's perfectly normal. Normal is around 8 to 12 centimeters. And that's right at the midclavicular line. So your liver isn't enlarged and it's a good size. Okay, Faith, now I'm going to see if I can feel for any splenic dullness or find where your spleen is. So Faith, I'm going to have you lay just like that on your side. That's perfect. And the spleen should be between the 6th and the 10th rib at the anterior axillary line. So I'm going to percuss right about here. Okay, so I'm feeling dullness right around the 7th rib. Yep, so the spleen is right in this area, which is normal, and it's around the 7th to 8th rib, which is perfectly fine and doesn't feel enlarged to me, and it's where it should be. Thank you. Okay, testicular exams are encouraged monthly. You want to teach the male to seek evaluation if they have any of the following. So painless lumps, swelling or enlargement in either testicle, pain or discomfort in the testicles or scrotum, feeling of heaviness or sudden fluid collection in the scrotum, a dull ache in the abdomen or the groin. The exam should be done right after the shower because it relaxes the scrotum. Note first by looking for any swelling in the scrotum. Examine each testicle with both hands by cupping the middle index finger under the testicle and place the thumbs on top and roll the testicles through the fingers. One testicle may be larger than the other, and that's okay. What you're really looking for is any lumps or any pain. The epididymis may be mistaken because it's a tube-like structure on the testicles that may have an abnormal lump, but it's not an abnormal lump. It's a perfectly fine assessment, and you want to have all lumps or abnormal findings assessed as soon as possible by the PCP. For examination of the breast, it's important to let the patients know what you're doing before you do it. The best time to do this exam is 5 to 7 days after onset of menses because that's when the breasts are least tender. I would have the patient in a sitting position and disrobe to the waist. I would then observe for any skin changes, symmetry of the breast, contours, and retraction. I would also look at the appearance of the skin and symmetry of size between the breasts. I would inspect with arms overhead on the hips and leaning forward to show for any dimpling and retraction. For palpation, I would have the patient lie in a supine position. We're checking for consistency of the tissue, tenderness, and any nodules. To check the lateral side of the breast, I will have the patient in a laying position, put their arm in alignment over their axilla and their hand over their forehead like this. I would use the finger pads of 2, 3, or 4 of my fingers, and I will be using a vertical strip pattern to detect for any masses in the breast. For the medial side, I'd ask the patient to put their hand over towards their neck and their arm like this. Then I would divide the breast into 4 quadrants. If a mass is found, I will describe the location by using the face of a clock and the distance from the nipple. For the nipple, I will put gloves on and look for any nipple discharge and check for elasticity and thickening. I will check over the axilla with the patient sitting with arms relaxed. It is important to check the lymph nodes. I will check for any rashes, infections, or any unusual pigmentation. And I will teach them to do a self-breast exam once a month, standing in the mirror.